The vertebrae are the individual bones that make up the vertebral column or the spine. This column is a central structural support for the body, providing protection for the spinal cord while allowing flexibility and movement. Humans typically have 33 vertebrae, and they are categorized based on their mobility. Of these 33, 24 are mobile and they articulate with each other. These include 7 cervical, 12 thoracic, and 5 lumbar vertebrae. The remaining 9 are fused and are immobile, comprising of 5 sacral and 4 coccygeal vertebrae. The mobile vertebrae forms the upper parts of the vertebral column, while the fused vertebrae forms the lower or the inferior parts of the vertebral column. The vertebral column protects the spinal cord and supports the body. Starting at the top, the cervical vertebrae, which are found in the neck, help to support the head, which weighs about 10 to 12 pounds. There are 7 cervical vertebrae, labeled through from C1 to C7. Moving down from the cervical vertebrae, we find the thoracic vertebrae. These 12 vertebrae, labeled from T1 through to T12, supports the rib cage and protects the heart and the lungs. They are less mobile when compared to the cervical or the lumbar vertebrae. So, below the thoracic vertebrae are the lumbar vertebrae. These 5 large vertebrae, labeled from L1 to L5, supports the body weight and assist in lifting heavy objects. Now, to remember the number of vertebrae in this category, think of meal times. Think of breakfast at 7 a.m., lunch at 12 p.m., and dinner at 5 p.m. For breakfast at 7 a.m., it represents the 7 cervical, and then for lunch at 12 p.m., it should help you remember the 12 thoracic, and then for dinner at 5 p.m., it should help you remember the 5 lumbar. Now, for the 9 fused vertebrae, they include 5 sacral vertebrae, which are labeled from S1 to S5, and then 4 coccygeal vertebrae forming the coccyx or the tailbone. The sacrum also connects with the hip bones to form the pelvis. Now, this is actually a point you have to note. So let's discuss the anatomy of each vertebra, starting from C1, which is also called atlas, and C2, which is also called axis. Now, C1 is ring-like and it is located just below the skull, allowing you to nod and make the yes movement. And then C2 has a projection called the dens or the odontoid process, enabling the head to rotate. Now, to remember this, think of the head rotating along its axis, and this will help you remember that C2 helps the head to rotate along its axis too. Now, each vertebrae except the first and second vertebrae, which we have discussed, have similar basic structure, and they compose of the following parts. Number 1, the vertebral body. They are the large and cylindrical anterior portion of the vertebra. Their functions is to bear weight and provide structural support. They are composed of spongy bones with a thin layer of compact bone, enabling their strength and support flexibility. The second one is the vertebral arc. Posterior to the vertebral body, the vertebral arc supports the spinal cord to form the vertebral foramen, which is comprised of the pedicle, which are short cylindrical bone projections connecting the vertebral body to the transverse process, and the lamina, which are flat plates of bones forming the posterior parts of the vertebral arc. Now, the third part is the processes. Vertebrae have several projections from muscle attachment and articulation of other bones. They include the spinal process, a single projection extending posteriorly. It is actually what is felt as the spine on the back. Then the transverse process, which extends laterally from each side of the vertebrae, serving as attachment points for muscles and ligaments. Then the articular processes, which are two superior and two inferior processes that articulate with adjacent vertebrae. Then number 4 is the vertebral foramen, the opening formed by the vertebral body and the vertebral arc. When stacked, this foramen creates the vertebral canal, housing and protecting the spinal cord. Number 5 is the intervertebral disc, located between the adjacent vertebral bodies, except between the C1 and C2, and in the sacrum and coccyx. It is composed of the annulus fibrosus, which are the outer fibrous ring, and the nucleus pulposus, and the nucleus pulposus, which are the inner gelatinous core. They function as shock absorber and they provide flexibility to the spine. Number 6 is the vertebral notches and the intervertebral foramen. They are the indentations on the superior and inferior edges of the pedicle that form the intervertebral foramen when the vertebrae are stalked. The foramen allows spinal nerves and blood vessels to pass through them. Now let's talk about the regional variations between the spine. The cervical vertebrae are actually small, with transverse foramen for vertebral arteries. The C1, also called the atlas, and the C2, also called axis, are specialized for the head movement. And then the thoracic vertebrae, they articulate with the ribs and they form the costal facets. The lumbar vertebrae are actually large and robust, and their main function is for weight bearing. Then the sacrum, which are fused with a single structure forming the posterior portion of the pelvis. Then the coccyx are a small triangular bone formed from fused coccygeal vertebrae, acting as a vestigial tailbone. So this video is actually a summary or an overview of the thoracic bone. If you found this video helpful, please give it a thumbs up and subscribe for more videos like this. Thanks for watching and see you in future videos.